we're going to look at the standard drug-resistant TB regimen. So under this, it includes, firstly, we are looking at questions. So we are going to ask only one question, and it's going to be, in case of the shorter oral bedaquiline regimen. So what does the bedaquiline regimen it includes? So we will find this answer and learn in detail about the DRTB regimen. So to begin with, first we are looking at the H-mono resistant. The H-mono resistant or the polydrug resistant TB regimen. Polydrug resistant TB regimen. So what does this include? This includes the levofloxacin, then it includes the rifampicin, it includes ethambutol, as well as the Z. Z, it stands for the pyrazinamide. So it includes all this. So in short, you can write levofloxacin, rifampicin, ethambutol, and the Z. The Z is nothing but for the pyrazinamide. So all this, if you see, it is given for 6M, that is for 6 months. So to look at the comments, that is, it is given for 6 months, and it is only oral drugs. It's given as the oral drugs only. Next, moving on, we look at the shorter oral bedaquiline regimen. So under this, it includes two phases. If you see, it has something known as the intense phase, and there is something known as the continuation phase. So what does this intense phase include? The intense phase is nothing but it acts the levofloxacin, and then there is also the bedaquiline. So there is the bedaquiline. So all this is for 6 months, and post this there is also the CFZ, cefazolin, then Z, that is pyrazinamide, and then H is for the isoniazid, then E for ethambutol, then we also have the ETO. ETO stands for the ethionamide. So all this, it comes for the 4 to 6 months. It comes for 4 to 6 months, and then we look at the continuation phase. So what about the continuation phase? In continuation phase, we have the levofloxacin, we have the cefazolin, we have the pyrazinamide, and the ethambutol. So this happens in the continuation phase. So what are the points to note here is that they are for 9 to 11 months. They are 9 to 11 months long, and the injectable used in there is an injectable which is used in the intense phase. So this is very important to note. Next, we'll move on to the longer MDR TB regimen. So what is the longer MDR TB regimen? So under the longer MDR TB regimen, firstly we have the BDQ. So what is the BDQ? Is nothing but 6 months or longer. It is 6 months or longer. That is the bedaquiline. And then we also have the levofloxacin, linezolid, cefazolin, and the CS, it stands for the cycloserine. So all this are the drugs, and what are the comments? It is about 18 to 20 months. It is about 18 to 20 months long. Then if you see the oral drugs, yes, it is oral drugs only. And next, the regimen is used for XDR-TB. It is used for the XDR-TB patients. and it is given for about 20 months. Now we'll be looking at the answers to our question. So we asked only one question here. So we asked about the shorter oral bedaquiline. Shorter oral bedaquiline regimen. So what is this regimen about? So here there is something known as the intense phase and the continuation phase. So under the intense phase there is the levofloxacin, that is the bedaquiline, and this is for 6 months. Then there is also the cefazolin, there is pyrazinamide, isoniazid, ethambutol, ethionamide. So this is for the 4 months. Then what about the continuation phase? Continuation phase, we have the levofloxacin, there is the cefazolin, then comes the pyrazinamide and the ethambutol. So all this comes for the 5 months. Now what are the comments? Comments is that this is about 9 to 11 months. So they are about 9 to 11 months long, and then there are injectables in case of the intensive phase. So it's basically I and I. Intensive is nothing but it is injectable.